basically we are now in week 12 of quarantine, and the last time we shot the video was in January, before the whole pandemic was a thing, before
It was
lockdown.
during. No, it wasn't it? Because we had that meeting.
No,
Remember we had that
it was
stigma
a
meeting?
public health epidemic, but it wasn't a pandemic
Oh
just
yeah, it
yet.
wasn't a pandemic then.
Yeah.
That's true.
And yeah, so now we're in lockdown still, well, for the next 2
No,
weeks
we're towards it.
apparently.
Yeah, lockdown restrictions are
And
lifting.
there've been so much things going on as well, especially in the US, about Black Lives Matter and like police brutality against black people being targeted, even in England. Ala wrote an article about Brighton being one of the cities in England where it's very, Brighton is very diverse, like it's very diverse, but then
It's very
even there,
liberal. It's considered
yeah,
quite liberal.
It's
Quote unquote liberal.
quote unquote. It's actually known as the gay capital of England.
Yeah, but if
That's
you're
the
black,
thing.
you're 11 times more likely to get stopped and searched by police. You're also more likely to make up the proportion of people that are wrongfully convicted and stopped and searched for no reason. And you're also more likely to get harassed by police if you're just around the city just for being black. And it shows some of the highest disparities in the whole of the UK, even higher than London. So
Higher than London?
Yeah, higher than London. London
Oh, that's
disparity,
a
I think
shocker.
you're 4 times more likely to get stopped if you're black in London, but in Brighton it's 11, and it used to be 15 last year, but it's gone down because the amount of stop and search arrests that they have like been doing has just gone down.
Okay.
It's just, you'd think it would be in London, but I guess because like a lot of crime in general happens in London, they probably tend to stop a lot of people more often. But in Brighton, it's just black people that get stopped. But anyway, we just thought it was interesting because a lot of the time when we're studying a lot of our subjects in global health, we have to keep in mind like the racial undertones.
Disparities.
Like the whole of global health is just like medical imperialism. So it's like we have to kind of be careful because it's like sometimes you have the right intentions, but really it's like racial roots. Like it comes from racial roots and racial backgrounds. So I feel like it's like a minefield in that sense.
And I think the issue of racial roots and background, a lot of the stuff was talked about as well. We always have either racism or colonization that's attached to it.
Yeah, true. Everything comes from either racism, discrimination, or colonization as a result of that or something like that.
I think my first group assignment was on maternal health in the US. And that's when we made the presentation, and it was quite interesting that black women are more than 3 times likely to die whilst giving birth as opposed to any other race.
Yeah, I did that whole essay on racial inferiority and superiority, and the effect that this has on the reproductive health of African American women. And it's just interesting because like it's just the precedents that were set during slavery and like the reproductive rights and lack of reproductive justice that occurred in slavery that has meant a lot of like the stereotypes of black people they come as a result of it. Like for example, do you know the stereotype of black families not having a father figure?
Dad.
That's because generally during slavery, when black women did have a choice to like pick who they had kids with, the men would often get moved from plantation to plantation a lot more than females would. So then there would be an absent father figure, and all the responsibilities fell onto the women, and that's where the stereotype of like, oh, they don't have a black father has come from. But really, it's because they've been forced out of these situations and they don't really have a choice in it. And like a lot of the stuff, especially the Jezebel stereotype of a black woman, that also comes from slavery period and how they were ostracized and how their bodies were just like commodified and things like that.
They were basically just raped by the slave owners.
And even by people that were supposed to like take care of them during the civil rights era, post-civil rights, even the doctors and all that stuff. So I just feel like a lot of the things that have happened back then are just the result of.
Another thing that I found interesting the other day, I was reading about hair, and it said that slave women used to be forced to put a headscarf on because like the slave masters were intrigued by their hair. It's like,
yeah.
that is something.
And like all of the white women, this is where the also Jezebel stereotype comes from. I read this interesting article, and it said that the black woman has been through 3 different like identity, like she's been grouped into 3 different types of identities, and I can't even remember the names of them, but one of them was the Jezebel, which is like this promiscuous black girl who goes to sleep with other people's men and like stuff like that. That comes from when the slave owners used to rape them, and they used to like be more infatuated with the slaves than they were with their actual wives and things like that. And then there was this other one, I actually can't remember. It was like Mary or something like, it was like motherly, and that's where like the motherly persona of a black woman, and the caring thing where a black woman just does everything to care for her kids and her family.
And a family.
And that also comes from where they've like brutalized them so much in slavery that they have this like family mentality where they do everything to protect their immediate kids, and like they don't really have like husbands and things like that because they've been taken away, and like the family they have is what they've been created, like what they've created. And then another one was like this like fighter woman who's also like against the system, and like fighting all the oppression and being like an activist against it. And that was for like the women that like aborted babies because they were raped and things like that, and then they'd be given this like image because they weren't like listening to the masses and stuff like that. It's just interesting how a lot of our personalities and a lot of our stereotypes have just come from it. We've just gone completely past the point.
There's like a strong historic
influence.
But influence.
Yeah. So anyway, we need to talk about
going back to
being black as a global health researcher, and how it's just a bit of a sticky situation. It's a bit of like a moral crisis half the time, because you're learning about AIDS, and you're talking about how all this stuff affects Africa so much, and how we need to help Africa, we need to do this, and all of our research needs to be focused there. But then you're like this is just all medical imperialism. You're just ruining some things. You've come and like we study stuff where like interventions have been put in place and they made the situation worse. Like people have tried to help.
For example, in the polio case in Afghanistan. I'm sorry if I got the country wrong. It's been a minute.
I think it is right. Yeah, polio in Afghanistan. Yeah. And also when they tried to like improve nutrition in one African country by giving everyone formula, but then that resulted in all the kids developing more illnesses and stuff like that, because they didn't emphasize because they didn't emphasize the importance of like breast milk and things like that. And I just feel like we have like kind of an obligation to like, I don't know, to like understand that although we're learning about helping the global south, a lot of the stuff that we're doing can be interpreted as just
westernization of medicine.
Yeah, further colonization of medicine. And it's like, it's kind of like we're fighting for all these black rights, but then we're propagating colonizing their medical.
And another thing on race and culture or whatever. One thing that I've noticed with global health is it says it's global health, but then it mostly leans towards low and middle income countries, and by low and middle income countries it's usually sub-Saharan Africa
and Asia.
Southeast Asia, and it's like I can't wait to see how they're going to talk about coronavirus in the future, because
it didn't affect Africa that much. It didn't really affect Southeast Asia that much.
So I wonder how they're going to talk about how England failed, because I mean they've tried as much as they can to control it, but 50,000 lives is still way too many.
And like there's case studies in like Italy that showed that because they started earlier, a lot of deaths were prevented. So it's interesting how they're going to talk about it. And remember the narrative that we always have, where I guess most like anthropology tries to take us away from it, but a lot of the other global health kind of pushes us to this narrative where it's like we're going to global south to help them, not to like learn from the way they're doing
it's things. Like we're going to teach them what we do.
And notice how, because Africa didn't have a lot of cases, it wasn't like they were like
intrigued
like
as to why not.
They weren't praising Africa or intrigued as to why not. They were just
surprised.
Trying to find ways to explain why they were affected so badly as opposed to like the other countries. And it's like, even in like Chad or in other like specific states where people have they left the borders open, like they still don't have that many cases, and people do travel in and out of the country, but there's just not that many cases. And it's just going to be really interesting because it really switches their narrative around, and it's like not
It's
like
not always the
it's not always
low middle income countries who get to suffer the burden of a disease, especially a pandemic.
no.
And the fun fact is, I think in the report of 2018 said that the three countries that were very equipped for a pandemic, like they were best equipped for a pandemic, was the UK. No, the US was number one. The US, the UK, and I think the Netherlands.
And look
And
at this now.
so, which pandemic were they talking about?
So honestly, but I guess that just goes to show that like the narrative kind of needs to go both ways, and if we need to like decolonize medical anthropology or whatever,
Decolonize global health.
global health. If we're gonna decolonize global health, we kind of have to look at it in like a give and take perspective, where like everyone's learning from everyone, and like we can learn as much from looking at our environment here in the UK as we can from going to sub-Saharan Africa and studying the transmission of communicable diseases there, because we have just as many problems here. We have double burden of disease here as well, and it's just a heavier double burden of disease over there, but it's because
we're still here.
Colonial history that we have that. But it's just interesting because I feel like it's like kind of an oxymoron for us to be in the global health and still be like advocates for Black activism and stuff like that, because
there's like a very thin line between being very, I don't want to say very Black, but then from looking at things from a very Black person perspective and the scientist perspective, like there's that, there's certain things that impact you differently when
the same things that impact you differently.
I've lost my train of thought now. Oh.
Well, like you said, we need to like be able to just understand that knowledge goes both ways, and that it's not it's not, I don't know, it's like we're always critiquing the health system in other countries, but instead of learning from it, like maybe there's a way, like I don't know, like maybe there's a reason that in sub-Saharan Africa the transmissions maybe haven't been, or the deaths haven't been as big, but they're not willing to learn that yet because they just want to like
say, oh, you're not testing enough, or you don't have equipment to measure statistics, like
But I mean, I feel like, if you really did pour all the statistics into Africa, they probably would be some sort of pattern of like high transmission. But I think because there's a lot of death like from other like sources, that it probably wouldn't be the main
thing.
Like prevalent, like it wouldn't be the highest thing.
I mean, but when you look at how it's been affecting other countries like Brazil at the moment, that's mad. They still have a whole lot of other stuff
in the West has been like detrimental compared to the social impact of disease in sub-Saharan African global South countries, because they're always exposed to like intermittent outbreak of disease and being able to like having their system having their social system disrupted for a while. But here it's just such a big thing that like.
Do you think that's why though?
I think that's also like a factor to it, because like in Sudan we have like loads of cholera outbreaks every here and then, and we have like people know how to handle infectious disease outbreaks.
I think
it's not
that's
like
why
a thing that people get scared about and people think the world's gonna end. Do you know what I mean? Like they've just been exposed to this kind of thing a lot more, and they're not as like quick to think the world's ending and go jump. Actually though, WhatsApp aunties have been running wild. But do you know what I mean? Maybe it's not the sole reason, but I do think because, come on, in Africa, there's mass vaccination campaigns all the time. Like getting your child, going to like a clinic and just getting everything checked out is just common for Africa. But in the UK, you don't really go and get vaccinations like that unless it's in school, or it's like a part of your curriculum where you really need to get it, or you're traveling.
Do you not have the whole 1 week, like when you get a newborn baby? Do you not get the whole thing, like how the midwife and stuff?
I haven't had a baby yet. But yeah, there's that little red book, and then you go around and you for all of them. Yeah. But I feel like in Sudan, it's just more frequent that we need to be exposed and we need to be more educated about this stuff. And in Sudan, they know everyone knows about water, sanitation, and hygiene, but we understand the importance of wash. Here, you have to teach people to wash their hands for 30 seconds twice a day. Like, I'm not going to say anything.
I refuse to say anything on that. I really, yeah, I refuse to comment. I'll
All
leave
I'm
it at
saying
that.
is, I think that Global South has been exposed to in outbreaks of disease a lot more often, so the social structure hasn't really been disrupted as much as it has in
That's
the
not.
West.
Hmm.
And it has like it won't be like coronavirus won't be a big thing in Global South because it's just
It
another.
might in
Maybe
those
we'll see.
rare cases, but the odds of that happening are very, very slim.
Yeah, but now the
Because by
coronavirus has
now,
changed the whole of
yeah,
Western society,
yeah,
literally. But yeah, I
the
think we should
social impact. I
I
feel
think we
like we've
should
talked
explore
about it
this.
way
I know, but I
more
feel like we
than.
should not today, but I feel like we should explore this whole decolonizing global health thing a bit more.
Fun fact: when I took her to my other school for what did we go there again? I can't remember why we went there, but basically we found this
Oh
decolonize my
yeah,
other
Sussex.
school. No,
Oh,
not the Sussex one. I said my other school, not our other school.
anyway.
And we found this decolonize the place, and it was basically talking about development. And the question that popped up the most was, when it comes to development, who actually says that, okay, this country is developed now? Like,
Oh
what criteria
yeah.
do you use?
Oh,
Like,
yeah. It was
from whose
basically like
perspective?
a photographic essay, and it was just
Mm-hmm.
showing this developmental company or whatever. It was showing
Mm-hmm.
examples of their work. So it was going around showing pictures of kids in Tanzania, like, but it wasn't really showing medical development, and it wasn't showing explicit pictures of development. It was just showing pictures of people in a poor background. So someone
It's
went around
like,
sticking question marks up, saying,
what's this got to do
what has
with
this got to do with
development?
development? Like, why are you using black suffering and black pain as like like a
The
token for your,
epitome
yeah, for
of
the epitome of your institute? Or why are you using it as like a photo essay? Like if you're gonna do anything about it, just do it rather than using something that isn't related to it. And it really like got us thinking, I guess, because we were like, oh yeah, like it was pictures of just kids rolling around playing football, and it was like Brazil helping helping developmental this and that. And it's like you won't look at that
how.
picture and think these kids are struggling and they need my help. You look at them and think they're having fun, they're doing what kids do. But I think that's just an important thing as well, because black suffering and black pain has literally been such a token thing, and it's just so like it's so what is, I don't even know what it's been. It's like
Western
monetized, it's
savior.
been monetized, and it's been like
Mm.
used as like something for people's conscience. And it's like they want to post pictures of black people in pain because they feel better about it, because they've raised awareness for it, but they don't understand like the implicit,
The
like
Western savior
the
mentality.
contradictory nature of it all. Really, yeah, my tongue was tied. But anyway, yeah, we've talked so much now, so let's start.
Yeah. All right.
Next
Bye.
time on Decolonizing Global Health, the pandemic is over. We can leave the
We
house.
can go outside. I can run. I can
Except you.
every single time I start recording, you come up with your.
Oh,
So basically, yeah, what we talked about today is
basically, what
that
we want to
global
say
health needs to be
is
decolonized. Wait,
by black
power to the
and
people.
people of color within the
The
field of
sector.
study that can contextualize information and contextualize interventions to make sure that they're culturally appropriate and that it doesn't seem like medical imperialism, because a lot of the stuff that we do as global health researchers can be considered medical imperialism.
Not can be considered is
It is medical imperialism,
medical
and it is
imperialism.
yeah, no. Okay, let's go.
Hi guys, welcome back to. Wait.
Wait, okay, we're doing a conclusion, right?
Hi guys,
What are
an
we doing?
introduction. Hi
Oh,
guys,
hi guys.
welcome back to our channel.